As Michigan State University prepares to welcome back students this fall, researchers are busy finding new ways to efficiently test them for the coronavirus. Nicole Buckman explains.
It starts with a simple spit test and can be done in the comfort of your home or in your dorm room.
You spit into a large tube. We have a separate tube that has a small amount of viral transport medium, which inactivates the virus and preserves the RNA that we collect in the sample so that we can run it in the lab.
Researchers then take the sample and run it with others. Lepton says this type of pool testing makes it easier to test more people with less resources.
Combining them together in groups of 8 or groups of 12 in order to be able to run one determination for a group of people. And that way it saves us time. We don't have to run as many samples, and it saves us materials.
If the pool turns out positive, then each person in the group will have to take a single test. By fall, Lepton plans to implement this voluntary surveillance program to staff and students on campus and test 2,000 people per day.
The ones we're mostly concerned about are the ones that are living with campus. And then we're going to be doing random sampling from those groups repeatedly throughout the semester in order to get a good picture of what's going on.
Researchers are also looking at on-campus wastewater testing for COVID and already finding correlation to the Harper's outbreak.
It became pretty clear that the COVID virus could be found in feces and thus in sewage. It was quite interesting that we saw this peak in East Lansing sewage, and when we looked at the dates, it coincided with the exposure time frame of the Harper's outbreak.
With this information, Rose and her team will continue to monitor on-campus wastewater this fall to try to give an early warning for potential outbreaks.
You can get the sample, get it processed quickly, and get it to public health. Public health can improve communication.
Plans for the spit test kit and surveillance testing are still being finalized. By September, MSU hopes to have a registration site available for both students and staff that are participating. In East Lansing, Nicole Buckman, Fox 47 News.
There will be pickup and drop-off locations for test samples on MSU's campus. Results from the spit kits will come back in 36 to 48 hours. Henry Ford Health Systems in Detroit started its first human trials of a potential COVID-19 vaccine today. Moderna is developing the vaccine in partnership with the National Institutes of Health. Henry Ford Health Systems is one of the 90 medical facilities across the country taking part in the phase 3 trial of the Moderna vaccine. Hair loss could be a new symptom of coronavirus. A doctor at the Indiana University School of Medicine, with the help of a COVID survivor group, set out to identify coronavirus symptoms that had previously gone unreported. Through a Facebook survey of more than 1,500 people, they found 98 possible symptoms of the virus, including balding. Nerve pain, difficulty concentrating, and blurry vision were also listed as possible signs of COVID-19. Smoking cannabis may not be good for your heart. The American Heart Association issuing a statement asking people to refrain from smoking cannabis because of potential heart, lung, and blood vessel issues. The AHA says while cannabis may have therapeutic benefits, further research is needed to, quote, better understand the cardiovascular and public health implications that now follow its decriminalization. Toxic hand sanitizers now prompting a spike in calls to poison control centers. Authorities saying they've seen a 70% surge in calls since last year. One of the major problems, people are using hand sanitizers that are too highly concentrated with methanol, which can be toxic when consumed or absorbed through the skin. The CDC recommends using a sanitizer that contains at least 60% ethanol when soap and water are not available. Having trouble finding disinfectant wipes at the store? Well, there's an easy and safe way to make them at home. Fox's Cassie Fambro shows us how.
Disinfectant wipes just haven't been on store shelves in months, so there is a safe way that you can make your own. I'm going to show you one of those ways, the simplest way to do it, and we talked to the Poison Control Center to make sure it's the safest way to do it.
If you're going to do this, you do want to use regular household strength bleach.
So I picked one of these standing plastic bags that holds a gallon, so it would be easy to measure.
Putting the solution in like a coffee jar or like a Pringles can or something like that, that might be mistaken by somebody else as a food product and they might try to eat it.
5 tablespoons of bleach will treat about a gallon of water. Make sure that the bleach that you're using isn't the kind that's splashless. You want bleach that actually disinfects. You're going to look on the label on the back of it for the ingredients. This one is sodium hypochlorite and sodium hydroxide.
It will kill coronavirus and all the other bad stuff that we don't want to be exposed to.
Tear or cut paper towels to the size that you want them and go ahead and stick them in your bag.
So it's really important to follow the recipe exactly how it's written.
And make sure to keep your animals and kids away from toxic chemicals too.
Definitely be careful of animals and young children. They're inquisitive by nature and they will certainly explore.
Now it's important to remember that any mix you make of your own disinfectant wipes will only last about 24 hours. After that, you need to make a new batch. And if anything happens and you get the mixture in your eyes or somebody swallows it, call the Poison Control Center.